Honorable Mansukh Mandaviya, a young dynamic minister of our Union Cabinet. He is a grassroots worker working for women and child welfare and has been awarded by UNICEF for the same. He took charge of Health Ministry on July 7th, 2021, and he basically holds a philosophy degree in political science from Gujarat Institute and Development and Research, Ahmedabad. He augmented the vaccine manufacture capacity of the country and boosted the COVID vaccination drive. And you can just imagine, with a population that India has, such a great drive, everybody appreciated that all over the world. For his efforts in fighting COVID, Indian Express, in its list of 100 most powerful Indians in 2022, placed him at number 5. Sir, I am thankful to you to accept the invitation to inaugurate OSSICON 2022. OSSI, as a body started in 2002 by Dr. Sri Patil, brought forwarded by few of our stalwarts who are present here, sir, Dr. Pradeep Chaube, Dr. Mufi Lakdawala, Dr. Raman Goyal, Dr. Mahendra Narwaria, Sanjay Borude, Dr. Palni Velu, and Dr. Shashank Shah. The seeds grown by all these seniors has grown over the years now, sir. Today, India is facing obesity as a challenge. This can be made to face this challenge is to address it at the core. Prevention is the best policy. OSSI, with its members, are trying to educate, stop, fight this menace of obesity. I wish our Honorable Health Minister should consent for the cause and speak a few kind words and declare the Congress open. Thank you. Thank you, sir. It's over to you, sir.
Namaskar. OSSICON 2022 के इस अवसर पर उपस्थित आप सभी लोगों को मेरी ओर से हार्दिक शुभकामनाएं। मुझे बताते हुए खुशी हो रही है कि इस कार्यक्रम में आप ओबेसिटी के संदर्भ में विचार विमर्श के लिए एकत्रित हो रहे हैं। ओबेसिटी और ओबेसिटी से कैसे हम मुक्त हो, वर्तमान समय में हमारे लिए एक समस्या भी है और उससे ये समस्या का हम सामना भी कर रहे हैं। भारत में लगभग 31.6% लोग आज मोटापे से ग्रस्त है। जैसे जैसे समय जा रहा है वैसे वैसे परसेंटेज बढ़ रहा है। रीजन केवल यही है और मैं मानता हूं कि समस्या का समाधान के लिए हमें केवल उसके लिए ट्रीटमेंट आइडेंटिफाई करें, इलाज करें, उसके लिए मेडिसिन आइडेंटिफाई करें, ये शायद उससे सॉल्यूशन मिलेगा, लेकिन बहुत कम सॉल्यूशन मिलेगा। मैं समझता हूं कि एक्चुअली सॉल्यूशन इसका क्या हो सकता है। हम कैसे स्वस्थ रहते थे, हमारी ओबेसिटी क्यों बढ़ रही है। मुझे लगता है कि सबसे ज्यादा लाइफस्टाइल पर डिपेंडेंट है। बेसिकली सभी एनिमल्स सारे दिन अपने खुराक के शोध में घूमते रहते हैं, तो उससे उसकी एक्सरसाइज भी हो जाती है। लेकिन जैसे मानव जीवन आगे बढ़ा, रिसर्च हुआ, रिसर्च से टेक्नोलॉजी का निर्माण हुआ और टेक्नोलॉजी को हमने हमारी जीवन के सुखाकारी के लिए हमने टेक्नोलॉजी का इस्तेमाल किया, उपयोग किया, करना चाहिए। उसमें कोई मेरा ऑब्जेक्शन नहीं और दिक्कत भी नहीं है। लेकिन समस्या यहां है कि ये टेक्नोलॉजी हमारे लिए है, हमारी हेल्थ को बिगाड़ने के लिए नहीं है। लेकिन हाँ, हर चीज का दो पहलू होता है। उसमें से सबसे हम लोगों ने टेक्नोलॉजी का एक पहलू को सबसे पहले इस्तेमाल किया, जिससे हमें सबसे कम से कम श्रम की आवश्यकता हो, ज्यादा से ज्यादा प्रोडक्शन हो। इसलिए हमारा शारीरिक श्रम टूट गया और शारीरिक हमारा श्रम कम हो जाने से हमारी जो श्रम की वजह से कैलोरी का यूज होता था वो कम हो गया, तो कैलोरी शरीर में बचने लगी, ओबेसिटी बचने लगी। हमारी लाइफस्टाइल और टेक्नोलॉजी दोनों एक दूसरे के पूरक है। जैसा मुझे पता है, मैं मेरे घर में 2 मंजिले का घर था, तो ऊपर मंजिले में जाने के लिए हम सीढ़ी का यूज करते थे। आज हम सीढ़ी के अलावा लिफ्ट का यूज कर रहे हैं। तो जब हम सीढ़ी सीढ़ी चढ़ते थे, उतरते थे, चढ़ते थे, उतरते थे, एक्सरसाइज होता था, श्रम होता था। और अभी लिफ्ट का यूज करने से हम ऊपर आसानी से पहुंच तो जाते हैं, लेकिन श्रम नहीं होता है। हमारी लाइफस्टाइल ने भी हमारी ओबेसिटी को बढ़ाई है, और इसलिए जीवन में श्रम का मूल्य है। और श्रम शायद आप काम के प्लेस पे नहीं कर रहे हैं, अभी सर्विस सेक्टर में आपका मेंटली श्रम होगा, शारीरिक श्रम नहीं होगा। तो मेंटली श्रम के बाद आप दिन में क्या चौक्कस टाइम एक्सरसाइज के लिए निकालते हो? क्या हम हमारा जीवन का एक हिस्सा इस टाइप के एक्सरसाइज में लगा दें, जिसमें श्रम भी हो जाए, एक्सरसाइज भी हो जाए और ओबेसिटी भी ना बढ़े? और इसलिए मुझे लगता है कि हमारे जीवन में व्यक्तिगत तौर पर मैं तो उसका प्रयोग कर रहा हूं। मैं आज भी पार्लियामेंट चालू होती है, पार्लियामेंट जाता हूं तो साइकिल का उपयोग करता हूं। मैं मेरे क्षेत्र में भी मैं समझता हूं आपको 2 किलोमीटर 5 किलोमीटर दूर जाना है तो आपको मोटरसाइकिल का यूज करना चाहिए, उसमें कोई दिक्कत नहीं है, कार का भी यूज करना चाहिए। ये टेक्नोलॉजी हमें उपकारक है, लेकिन हम टेक्नोलॉजी का एक्सेस यूज करने से, आपको नजदीक जाना है और आपके पास समय है, तो क्यों ना आप साइकिल लेके जाओ। मैं देखता हूं आज गांव में किसान भी अपने पास बैल होते हैं और गांव से नजदीक अपना फार्म होता है, लेकिन जब वो अपने फार्म पे जाते हैं तो टू व्हील लेके जाते हैं, और टू व्हील लेके वहां जाते हैं, घर पे बैल होते हैं, उसका उपयोग के अलावा वो ट्रैक्टर का यूज कर लेते हैं। आपके पास 100 एकड़ लैंड है और आप ट्रैक्टर का यूज कर ले, वो सही बात है, करना चाहिए। लेकिन आपके पास 2 एकड़ लैंड है और 2 बैल है, और बैल प्रति महीने उसको फोडर के लिए प्रति वर्ष 40-50 हजार रुपए का खर्च हो जाता है, और एक खर्च के अलावा भी आप उसका उपयोग नहीं करते और ट्रैक्टर से अपना फार्मिंग करवा लेते हैं, तो बैल भी श्रम नहीं करता और आप भी श्रम नहीं करते। तो श्रम आवश्यक है और एक्सरसाइज आवश्यक है, वो जीवन का एक हिस्सा बनाना चाहिए। और इसलिए मोदी जी ने फिट इंडिया की बात कही है। फिट इंडिया मीन्स हर नागरिक स्वयं अपने स्वयं को फिट रखे, और किस लिए रखे। मेरा आग्रह है कि ये काम किसी का नहीं है। अभी मुझे तो खुशी भी इसलिए ही है कि आप एज ए डॉक्टर होके ओबेसिटी के बारे में चिंता कर रहे हैं। ये आपकी एक तरह से जिम्मेवारी भी है, लेकिन ये इश्यू तो सोसाइटी का है। मेरे में मोटापा है तो मेरा व्यक्तिगत जीवन में उसकी इफेक्ट है भाई, मैं हेल्थी नहीं रहूंगा। और आपने देखा होगा कोविड क्राइसिस में सबसे ज्यादा, जो कुल मिला के मेरे पास डेटा आ रहे थे, जब हम बीमार होते हैं और ऐसी स्थिति में ओबेसिटी उस वक्त दिखाई देती है, उसका नेगेटिव इफेक्ट। ओबेसिटी वालों को कोविड क्राइसिस में ज्यादा इफेक्ट हुई थी। ये तो डेटा और हमारे कोविड मैनेजमेंट से निकली हुई बात है। तो ये चीज इसलिए महत्वपूर्ण है कि हम स्वयं को ही फिट रखें, और स्वयं को फिट रखने के लिए हमसे क्या हो सकता है, वहां से हम शुरू करें। आप सब डॉक्टर मित्रों को मेरी ओर से हार्दिक शुभकामना भी है, और केवल उसके लिए व्यापक पब्लिक अवेयरनेस कैसे हो, जनता स्वयं एफर्ट कैसे करे, हर व्यक्ति में ऐसा हो कि मुझे फिट रहना है, तब इंडिया फिट रहेगा, और इंडिया फिट होगा तो इंडिया स्वस्थ होगा, और स्वस्थ भारत ही समृद्ध राष्ट्र का निर्माण कर सकता है। और इसलिए समृद्ध राष्ट्र की कल्पना जब हम करते हैं, उसके केंद्र में भी नागरिक का स्वास्थ्य जुड़ा हुआ होता है। लॉन्ग दीर्घायु के लिए भी ओबेसिटी खतरे की निशानी है। और एक बार आप ओबेसिटी ग्रस्त हो गए, कई डिसीज आपको आसानी से लागू हो सकता है। ये मुझे बताने की आवश्यकता नहीं है, आप डॉक्टर होने के नाते मेरे से ज्यादा समझते हैं और मेरे से ज्यादा जानते भी। लेकिन ये एफर्ट हम लोग सब लोग साथ में मिलके, एज ए गवर्नमेंट, एज ए डॉक्टर्स, हमारे मीडिया कर्मी भाइयों, सोसाइटी में अग्रेसर है ऐसे लोग, सब लोग साथ में मिलके कुछ ना कुछ तो कार्य योजना करनी ही होगी, क्योंकि ओबेसिटी कोई ऐसा विषय नहीं है कि हम उसको रोक नहीं सकते। ये कोई डिसीज नहीं है कि हम उसका इलाज कराने के लिए चले जाए। ये केवल हेल्थ मैनेजमेंट है, लाइफस्टाइल मैनेजमेंट है, स्वयं डिसिप्लिन से निकली हुई व्यवस्थाएं है। हम स्वयं डिसिप्लिन को फॉलो करके हमारी लाइफस्टाइल को जो एक बार सेट कर देंगे, लाइफस्टाइल विथ एक्सरसाइज बनेगी। आप दिन में जितनी कैलोरी लेते हो इतना कैलोरी का कंजप्शन हो जाए। आज तो टेक्नोलॉजी आपके हाथ में है। जब आप वॉकिंग के लिए निकलते हैं, आपके यहाँ आपके साथ वॉच होती है। अभी तो मैं देख रहा था एप्पल की वॉच है, उसमें सारा इंफॉर्मेशन उसमें ही होती है। आप वॉकिंग करेंगे, कितने डग चले हैं, आपकी कितनी कैलोरी जली हुई है, कितनी कैलोरी लॉस्ट हुई है, सारी चीज, सारी इंफॉर्मेशन आपको आपकी क्लॉक में मिलती है। तो ये सुविधा है, ये टेक्नोलॉजी है, वहां उसका यूज है। जहां यूज है वहां हम उसका बेस्ट इस्तेमाल करें और हम हमारे हेल्थ को सुनिश्चित करें। मैं चाहता हूं कि हम सब लोग साथ में मिलकर करें। आज आपके सेमिनार के अवसर पर मुझे मेरे मित्र अजय भाई ने कहा था कि आपको जुड़ना ही जुड़ना है। एक मीटिंग मेरी चालू है, दूसरी मीटिंग छोड़ के आपके बीच में आया हूं, लेकिन आप एक अच्छा विषय लेके निकले हुए हैं, तो मेरे मन में भी ऐसा था कि मैं भी उसमें थोड़े समय के लिए पार्टिसिपेट कर लूं। आप सब लोगों को मेरी ओर से हार्दिक हार्दिक शुभकामनाएं। धन्यवाद।
थैंक यू। धन्यवाद हेल्थ मिनिस्टर साहब। आपका विजन और हमारा विजन स्वस्थ भारत और स्वच्छ भारत दोनों साथ में लेके चलने का है। आपने बहुत अच्छा बोला और बहुत दूर का बोला। बहुत सुंदर बात है, बहुत सही बात है, बस समझ में आने वाली बात है। हम भी समझा समझा के थक गए, सब समझा समझा के थक गए। जब समझ में आ गई तो अपने आप भारत स्वस्थ होगा। इसके साथ मैं मिस्टर ऑर्गेनाइजिंग चेयरमैन शिवराम जी को इनवाइट करता हूँ वोट ऑफ थैंक्स के लिए, और उसके बाद हेल्थ मिनिस्टर हमारे अपने व्यस्त कार्यक्रम में से निकाल के आए। उसके बाद आप अपना कार्यक्रम कंटिन्यू कर सकते हैं सर। शिवराम सर।
Thank you, Dr. Manish. It's a great historic event for Obesity Surgery Society of India. Our country's health minister has spared half an hour for us and educating everybody about the problem of obesity. We are very, very thankful to you, sir. Dr. Mansukh Mandaviya, the Central Health and Family Welfare Minister, for sparing time with us and also enlightening on how a simple thing like lifestyle can help everybody to come out of obesity. Technology we should use for the benefit of health and also preventing obesity. In this direction, I want to inform you, sir, tomorrow morning we are having a Fight Obesity Walkathon where more than 200 people are taking part and we are creating awareness. Our society is in the forefront of not only research and also educating people, but also it is very much in creating public awareness and improving their health without our knife putting on them. So I must thank you very much, sir, and I invite everybody, the dignitaries, to please come and light the lamp so that in presence of Health Minister, he has already inaugurated. I request 2 minutes of your time, sir. Please be there. Manish, please take over.
I request all the dignitaries as well as the past presidents and trustees to come up for the lamp lighting ceremony. I'd request the guest of honor, Dr. G. Siddesh, the international oration speaker, Dr. Nimeri, also to join. Dr. Praveen Raj, President-elect.
धन्यवाद स्वास्थ्य मंत्री जी, आपने अपने कीमती समय को निकाल के हम लोगों का मनोबल बढ़ाया, उत्साह बढ़ाया और जैसा शिवराम साहब ने कहा कि ये एक हिस्टोरिक मोमेंट है। जब आप जैसे लोग जुड़ते हैं इस तरह के, तो इस तरह का मूवमेंट एक मूवमेंट का रूप ले सकता है ये, और लोगों को हम और अच्छे तरीके से समझा सकते हैं कि स्वस्थ रहना कितना ज़रूरी है और स्वस्थ रहने के लिए कोई खर्चा भी नहीं लगता। जैसा आपने बिल्कुल सही बोला, न दवा न दुआ, सिर्फ एक्सरसाइज करनी है, सड़क पे फ्री है, पार्क फ्री है, हवा फ्री है, कसरत करें और अपने आप को स्वस्थ रखें। बहुत बहुत धन्यवाद आपका जो आप पधारे और हम लोगों का मनोबल बढ़ाया। थैंक यू सर।
Thank you, everyone. I request everybody who is standing behind, please be seated. We'll begin a short inauguration function, as well as we have important agenda also to cover, including the orations and also the release of the e-souvenir and the release of the Journal of Bariatric Surgery as well. May I request the dignitaries to come on stage, Dr. Manish Khaitan, President OSSI, Dr. H.V. Shivram, Chairman and Organizing Chairman for OSSICON2022, Dr. Randeep Wadhavan, Secretary OSSI, Dr. G. Siddesh, President, Association of Surgeons of India. Dr. Siddesh, are you in the hall? Okay. Dr. Praveen Raj, President-elect, OSSI. Dr. Sumit Talwar, Organizing Secretary of OSSICON 2022. And our international orator, Dr. Abdul Rahman Nimeri, to join the dignitaries on the dais. On behalf of the organizing committee of the OSSICON 2022, we begin the inaugural function, which has already been started off and initiated by the Chief Guest, Sri Mansukh Mandaviya, Honorable Health and Family Welfare Minister of India. We begin the formal inauguration with the invocation by Mr. Raghuram Manikandan. Raghuram is a 12th year student who's started his music journey very early due to his influence of his parents, and also become adept on the social media by joining his mentor M. Kuldeep Pai's classes online and his channel. So Dr. Raghuram Manikandan, the invocation.
Hello. ओंकाराकारिणि मदहंकारवारिणि अवतु माम्। ओंकार आकारिणि मदहंकारवारिणि अवतु माम्। ओंकार आकारिणि मदहंकारवारिणि अवतु माम्। ओंकाराकारिणि अवतु माम् हंकार मात्रशत्रुदमनी हंकार मात्रशत्रुदमनी ह्रीङ्कार रूपिणी रुद्राणी हंकार मात्रशत्रुदमनी ह्रीङ्कार रूपिणी रुद्राणी ओंकाराकारिणी अवतु माम् मुरली सुधा लहरी बिहारी पुररिपु प्रेमित त्रिपुर सुंदरी मुरली सुधा लहरी बिहारी पुररिपु प्रेमित त्रिपुर सुंदरी करुणारस भरित ललित लवंगी ललित लवंगी ललित लवंगी करुणारस भरित ललित लवंगी वरदा अभयद सकल शुभांगी करुणारस भरित ललित लवंगी वरदा अभयद सकल शुभांगी ओंकार आकारिणी मदहंकार वारिणी अवतु माम् ओंकाराकारिणी ओ
Can we have a big round of applause for Raghuram Manikandan, a budding talent of India? Just a token of appreciation. All the best. I now request Dr. Shivram, Organizing Chairman of OSSICON 2022, to welcome the gathering.
Good evening, everybody. I welcome you all, first of all, for this wonderful evening and OSSICON 2022. It is like a dream coming true for us, the organizing committee, who have worked very hard for the success of this Congress. When we took up this responsibility at Calcutta in 2019, so we had no idea what we were undertaking. But as the conference came nearer, we had a lot of hurdles. Because of COVID, we had to postpone. Again, we rescheduled. That also had to be postponed. Finally, now it is happening. I welcome our Aussie President, Dr. Manish Khaitan, and welcome him from all the organizing committee side. Also our Secretary, Dr. Randeep Wadhawan, both of them have worked very hard for the success of this conference. Our international orator, Aussie international orator, Dr. Abdul Rahman Nimeri, has come all the way from USA. When we invited him, he was never unwilling or unhappy to travel such long distance and always communicated with us very well and came on time and also participated in all the events with us. We are very, very thankful to you, and we are going to hear your international oration, which is instituted by Obesity Surgery Society of India. Dr. Praveen Raj, the incoming president, is always with us. We are very, very thankful to him again. We have our international guests again from the UK with our BOMS delegates. Dr. All the three of them you have heard today, and it is our great pleasure to welcome all of you, sir. All the faculty, when we invited, they have accepted our invitation and they have gathered, and also all the delegates who are attending this, I welcome you all. Such a big conference cannot be happening without the support of the industry and the sponsors, and I welcome all of them for this inaugural function. And also our organizing committee people who are all there and who have worked here very hard, I welcome you all for this evening. Thank you all, and we'll have a good evening after this function. So please stay and enjoy our hospitality also. Thank you.
We have a couple of orations. To start off with, we have the Aussie presidential oration. I request Dr. Praveen Raj, President-elect, to read out the citation of the Aussie presidential orator, Dr. Manish Khaitan.
So good evening, friends. It's a pleasure and also a privilege to read out the citation of a dear friend, Dr. Manish Khaitan, who's the current president and also the outgoing president. So Dr. Manish Khaitan is the chief surgeon and director at No Obesity Bariatric Center located at KD Hospital, Ahmedabad. He did his graduation and post-graduation with a gold medal from BJ Medical College, Civil Hospital, Ahmedabad. He has had his fellowship training in the field of gastrosurgery and laparoscopic surgery with Professor Surendra Ugale, Dr. G.V. Rao, and Dr. Kelvin Eager. He's well versed with all advanced techniques pertaining to the field of gastrosurgery and has been performing advanced gastrosurgery since the last 20 years, which includes laparoscopic and advanced open surgeries. He first started his obesity clinic at Medilink Hospital, the full team comprising of surgeons, anesthetists, intensivists, dietitians, physiotherapists, metabolic physician, chest physician, and sport therapist. Over a period of time, he began primarily focusing in obesity surgeries, trying to bring changes in the lives of morbidly obese patients. Having performed over 5,000 bariatric surgeries over time, he is India's one of the finest surgeons. He's also actively involved himself in training surgeons in the field of bariatric surgery and has played a major role in establishing the FMBS Fellowship in Metabolic and Bariatric Surgery program by OSSI. He has published multiple national and international papers in index journals and has involved in active research and guiding researchers for research in the field of bariatrics and GI surgery. He was instrumental in launching the Journal of Bariatric Surgery, JBS, during his tenure as the president of OSSI. I welcome you, Dr. Manish Khaitan, to deliver the presidential oration.
Thank you, Dr. Praveen Raj. The presidential oration by Dr. Manish Khaitan.
So, the words are kind. Thank you, Praveen. And I don't wish to give any oration. I only want to congratulate you, Shivram. A great job done. But since it is customary, we will speak few words. And I'd like to speak about bariatric surgery in India, past, present, and future. So in 1999, it was started by VBG, and it was performed in Pune by Dr. Sri Dhore Patil, and it was a laparotomy. First live workshop, 1999, 3 VBGs were done. Correct me, Dr. Dhore Patil, if I'm wrong. In 2001, first LBG, lap band, was performed by Dr. Sri Dhore Patil. First RYGB by Mufi Lakdawala, it may be controversial, nobody should take it wrong, but whatever I got from internet, I'm telling you. 2005, first lap sleeve was demonstrated by Michel Garnier, and then followed by Bala Shanamugam. In 2007, first lap OAGB was done by Dr. K. Escola. Since then, we are going ahead, and in 2018, Dr. Mohit Bhandari and Dr. Mal Phobi organized Bariatric Metabolic Surgery Standardization World Consensus Meet. Now, OSSI has around more than 200 publications done in peer-reviewed journals till date. OSSI, as a society, alone published 3 articles in peer-reviewed journal in last year alone. That is what you are seeing now. What is about OSSI? Established in 2002 by Dr. Dhore Patil, it was Dr. Andrew Jamieson, then the Vice President IFSO, who recommended OSSI association to IFSO. OSSI joined IFSO in 2003, and then since then, IFSO has been attended by a large contingent of OSSI members with numerous presentations. There are 470 life members and 30 integrated health members. So these are the doyens of bariatric surgery. Due to their efforts, we all are here standing now, and bariatric surgery has seen light of the day and is progressing. So I am indebted towards Dr. Srihare Dhore Patil, Dr. Raman. In fact, the bariatric community is indebted towards you, sir. Dr. Raman Goel, sir, Dr. Pradeep Chaube, sir, Dr. Mahen Narwaria, sir, Dr. Sanjay Bude, sir, Dr. Shashank Shah, sir, Dr. Bala Shanumugam, and Mufazzal Lakdawala, sir. In public sector also, Dr. Sandeep Agrawal and Dr. Pavninder Lal has done a lot of work so as it has got a recognition at the Government of India level at CGHS. And recently, DNB has approved FNB course in bariatric surgery, the first structured course. The second structured course, I would say, it is not the first structured course. The first structured course has already been started and established by Dr. Randeep Vadhavan and Raj Palyanappa as an FMBS course by OSSI. OSSI made guidelines and awarded COE according to the guidelines, 23 centers as of today. Fellowship programs for 1 year is offered in this center for young surgeons, helping them to establish themselves as a bariatric surgeon through a structured program. These are the OSSICON. We have been doing OSSICON very regularly since it has been established, barring that one COVID year where we have to postpone it. And I, as a president, outgoing president, I'll welcome you all in Mumbai in 2023 for the next OSSICON. Honors. So we gave, if so, a president from our side, Dr. Pradeep Chaube, from 2012 to 2013. President IFSO APC, Dr. Mufazzal Lakdawala. Procedures. We present proudly that standardization of procedures by OSSI has been taken and completed this year. Lap sleeve, lap RYGB, lap OAGB, and various other procedures are performed and the data published in peer-reviewed journal. These are the name of procedure. Long-term data is yet to be seen for efficacy of these procedures performed. So standardization of these procedures is yet to happen. To start with, there were few numbers to count upon initially, which has grown up to more than 10,000 procedures per year post-COVID. OSSI launches its own registry into 2022. Exact data will be easy to collect henceforth. Now, since insurance sector has opened up for coverage of bariatric surgery, numbers has to be exponential now, as according to a survey conducted by a private organization, around 135 million, 1.35 it should be, million people in India suffered from morbid obesity, and they may need surgery to cure obesity and related comorbidities. So what is the way forward? Structured courses in COE to bring more trained surgeons into the system. Structured courses in allied health to build a strong post-surgery support system for the patients. OSSI should indulge in talk with government for treatment of obesity in public sector. Start bariatric treatment in government hospital as a subspecialty. Insurance should be sensitized more towards the need of Indian patients, and the process should be made more smooth. Starting hiccups are there because we all are seeing the starting hiccups and we'll be discussing it tomorrow. More hospitals should take the responsibility of holistic teaching approach towards conservative, surgical management of obesity and treatment of complication, both surgical and endoscopic. And I hope Dr. Praveen Raj will take this approach forward in his presidency. Thank you very much.
Thank you, Dr. Manish Khaitan, for a wonderful, short and crisp presidential oration. from the organizing team of OSSICON 2022, we would like to felicitate Dr. Manish Khaitan. If the dignitaries could also join in. Ladies and gentlemen, presenting Dr. Manish Khaitan, President, OSSI. It's a typical Mysore Petha. Thank you, dignitaries, and thank you, Dr. Manish Khaitan, as well. We'll be doing the release of the e-souvenir a bit later, once Dr. Siddesh arrives. We move on to the next oration of the evening, the OSSI International Oration. I would request Dr. Randeep Wadawan, Secretary OSSI, to read out the citation of OSSI International Orator, Dr. Abdul Rahman Nimeri. Dr. Randeep Wadawan.
Thank you. Dignitaries on the dais, friends, a very good evening to all of you. It's my immense pleasure to welcome Dr. Nimeri and a privilege to read his citation for the OSSI International Oration 2022. Dr. Nimeri completed his MD at the Al-Azhar University School of Medicine from Egypt. He received the highest performance in anatomy, pathology, and surgery, and an overall highest honors. Subsequently, he traveled to the US for further studies. He completed his internship in internal medicine at the University of Illinois, Urbana, received a commendation for outstanding performance in general surgery residency. He received the Outstanding Resident Award and Best Surgery Resident Award. Subsequently, he did fellowship in minimally invasive and bariatric surgery from the Washington University, St. Louis. Dr. Nimeri has also completed postdoctoral health leadership course from the Business School for the World, Abu Dhabi, and a surgical leadership program from the Harvard Medical School, Boston. He's the founding member of the Executive Board of Gulf Obesity Surgery Society and the past president of IFSO MINAC, which is Middle East and North African chapter. Dr. Nimeri was the chairman of the Scientific Committee of IFSO at the 23rd Annual World Congress in Dubai. He's been the vice chairman of the Communication Committee of IFSO and is presently the treasurer of IFSO. He's also a member of the Clinical Issues and Guidelines Committee of the ASMBS. He's the proud recipient of the IFSO Presidential Medal in 2017 in London and the IFSO Ambassador Award in 2019 at Madrid in Spain. He is presently the Associate Editor of the Obesity Surgery Journal, Reviewer of the International Journal of Obesity, Surgical Endoscopy, SOAD, and if I may add, Journal of Bariatric Surgery. He has published more than 60 peer-reviewed publications, several book chapters, and innumerable guest lectures at international conferences. He is presently working as an Associate Professor of Surgery at the University of North Carolina and a Faculty of Bariatric and Metabolic Surgery at the Carolinas Medical Center, the Atrium Health. The Obesity Surgery Society of India feels immensely privileged to honor Dr. Abdul Rahman Ali Nimeri with the International Oration for 2022 during the OSSICON 2022 at Bengaluru on his chosen topic of quality improvement in bariatric and metabolic surgery. Welcome, Dr. Nimeri.
Thank you, Dr. Wadawan. Ladies and gentlemen, the OSSI International Oration by Dr. Nimeri.
Thank you very much. This is really undeserving, and I really appreciate the kind words. And I want to thank the Obesity Surgery Society of India, Dr. Shivaram, and thank Randeep, the current president, and the president-elect for their kind invitation to come and speak today. So I chose to speak to you about quality improvement, something that I really feel that we can make a big difference with, because the surgery we do, even though has significant amount of safety, it can be improved if you look at quality improvement. So this is my disclosure slide, and it has no bearing on the presentation. So I'll talk to you first about the story of the American College of Surgeons and how Joint Commission came about, and if you ever heard of Dr. Codman. And I want to touch a little bit about the fact that our field is very diverse, depending on where you practice in the world, and if so, represents many diverse communities of surgeons, and that affects the way we actually decide how to perform quality improvement. And then I'll talk to you a little bit about quality improvement from the perspective of the MBSA QIP, which is our own quality improvement in the US. And then at the end, just talk a little bit about things we're doing at our own institution that we instituted in the last 4 years, trying to concentrate on not only quality, but cost to improve the value of care delivered. So many of you might not know this gentleman, but Dr. Codman was one of the first people to focus on the end result idea. He graduated from Harvard in 1895, and he kept talking to people about doing morbidity and mortality meetings and talking about outcomes until he was kicked out of Mass General Hospital. So he went and opened his own hospital, and he used to say that every hospital should follow every patient it treats long enough to determine whether or not the treatment was successful, and then inquire, if not, why not? And he used to take an index card, the index card you can see in the right lower corner, and write every patient's information and call the patient a year later and ask him a simple question: did the surgery help you? And if the patient said no, he would consider the surgery a failure. So he came to the Shoulder Society that he put together in Boston, and he told them that surgeons should stop doing shoulder surgery. Could you guess why? He told them, every surgeon I bring back a year later says their shoulder is worse off than before they had the surgery, because there was no physical therapy. Now, Dr. Codman realized the surgery didn't work. He didn't know why, but he knew the surgery didn't work. At the time, many surgeons didn't. He was invited in 1915 to chair a meeting where the mayor from Boston was present, and he produced this picture or diagram, telling them that surgeons in the community at Mass General are like this ostrich, putting their head in the sand, and that the patients are giving them their money, but they don't know that the surgeons don't know. Now, he was promptly kicked out of the society, and Dr. Codman died an unknown figure in 1940 from melanoma. He helped establish the American College of Surgeons and the Joint Commission, but the American College of Surgeons recognized him in the late 1990s, early 2000, as a very well-known figure. And today in Boston, the Codman Square Health Center is recognized after Codman. So sometimes you could be really ahead of your time, and I think this is one of the things that we need to focus on also in bariatric surgery. However, we are faced with a disease and a society that treats it where we have very diverse diseases. If you look at the IFSO Global Registry, even though the median BMI and median age could look like this, 42 and 41, if you look at where exactly is the surgery done, there is a significant amount of diversity of BMI, significant diversity of age, a very large range of medical problems, and the types of procedures are done depending on where they're done. The length of stay depends on many things, and in the 65 national societies in the 5 chapters, what patients get in terms of workup, guidelines, reimbursement, how the disease is treated is completely different. What surgeries are offered, as you well know from this important publication from Angrisani, it looks very different depending on which chapter you operate on. So when you focus on quality improvement, there has to be a way by which you could actually bring this together and do things that can be replicated wherever you go. So I want to show you something we've done at our institution following MBA-SEQUIP and tell you that this is something that can be reproduced. And I heard today that you have your registry already started, so maybe this is something that you could continue on. So this gentleman is the gentleman who's the surgeon who founded the ACS NSQIP in the US, the late Shukri Khouri. He was a cardiothoracic surgeon, and early on in the 80s, he was called into Congress because in the news, it was reported that the outcomes of cardiovascular surgery was not good at the VA. And he was asked to do something about it. So he collected several residents, some nurses, and started to look at the outcomes of patients who had cardiovascular surgery at the VA. And then he brought together an idea of deciding which outcomes are important, and he brought the VA Surgical Quality Improvement Program, which became the American College of Surgeons National Surgical Quality Improvement Program. In bariatric surgery, initially we started separated. So on the left, the American College of Surgeons had its own program called BSCN, and on the right, the American Society of Metabolic Surgery had its own program. And this started in 2007, but by 2012, they combined, and we now have one registry called the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. And similar to what I heard today, it not only is a registry to accredit centers of excellence, but more importantly, it reports on 100% of data and gives surgeons risk-adjusted reports every 6 months. So it contains not only centers in the US, but when I was in Abu Dhabi, we were the first international center to be a member of MBA-SEQUIP. So you could join even if you're international. There are now sites in many, many places. So the beauty of this program is that the surgeon champion, who's the one leading the quality of the program, has access to all the data that's not risk-adjusted, but also has data on risk-adjusted reports that come to you every 6 months. And I want to show you one example of things we've done in the last few years, just looking at what this report could generate. So the idea is you need to start somewhere. If you want to improve something, you need to first collect the data, but then next you need to start somewhere. So a report came to us and it told us that our re-interventions of the gastric bypass was more than it is expected. Out of 307 gastric bypasses, 3%, a little over 3% had re-interventions, meaning they had an endoscopy after gastric bypass. So this is the starting point. So the first thing we did is a report allows you to pull the data. So you could pull all the cases. So we looked at them, looked at all the cases to see if there's any trend. But this is not enough. This is only the tip of the iceberg. It helps you decide where exactly to tackle quality improvement. So what we did was a journey looking at re-interventions after gastric bypass. So first, we look at 5 years of data, more than 1,000 patients, different techniques, EEA, linear, robotic hand sewn. And what we found was our patients, the chance of someone needing an endoscopy after gastric bypass at our institutions, surgery done by 5 surgeons, is close to 20%, 1 in 5. And it was higher if you had it after a circular staple anastomosis. We found that the stricture rate was also higher after circular staple anastomosis. But this was not enough. We wanted to make sure that we exclude things like stricture, things like, not stricture rather, like steroid use, like NSAID use. So what we did after we shared the data with our surgeons, that the rate of our endoscopy after gastric bypass is actually higher than what showed in the report if you look at all cases over years. The rate of marginal ulcer was 7%, the rate of stricture was 3%, and we had issues with negative endoscopies. So next, we wanted to look at what exactly is the cause of these complications. So first, we looked at stricture, and we found that the circular stapled anastomosis, even though it's 25, it leads to the highest number of strictures in our practice. So 5% of all strictures are from circular stapled, and linear and robotic hand sewn are much lower. So this is information we brought back to surgeons who do circular stapled anastomosis to try to look at what techniques they can do to try to improve this. Then we looked at marginal ulcer, and we found that similarly, circular stapled anastomosis in our practice represents 9.3% of the marginal ulcers compared to a little less than 5% in linear stapled anastomosis. And our surgeons started to look with other surgeons about things that can be causing this. And then this allowed us to actually go a little further. So we reviewed 10-year data looking at all patients who had gastric bypass over the last 10 years and included patients who had hand-sewn anastomosis, not just robotic, linear, and circular. And again, the trend persisted, that circular stapled anastomosis appears to be the culprit, and it carries the highest complication rate amongst our patients. Then an idea came that maybe the pouch size is the reason in many patients. So we pulled all the patients who had endoscopy that showed a marginal ulcer versus patients who did not have an endoscopy after a marginal ulcer, excluded all strictures and looked at a matched sample, and we were able to show that it wasn't only the technique, but it was the size of the pouch. If the pouch was bigger, the chance for developing a marginal ulcer is higher. And every 5 centimeter increase can lead to more than double rate of marginal ulcer. So just within one center, small institution, by looking at an area that was focused by a report from a registry, we're able to learn a lot of things and give feedback to our own surgeons to what exactly they should look at. And I can tell you, it's not easy at the beginning because we as surgeons don't like our colleagues telling us that what we're doing is not great, it's not perfect. But I think this is the journey that we have to actually do. Now, I want to share with you how our surgeons at our practice are looked at and how they look at our practice. So we have a dashboard that contains every procedure a surgeon does that's reviewed with the surgeons on a monthly basis. So these are the 5 surgeons in our practice. And to make sure that the dashboard is fair, we only include primary cases, we only include gastric bypass and sleeve gastrectomy, because if you start including duodenal switches and revisions, things can get confusing. So every year, we decide to choose what are the 4 things we're going to look at. So for the last 2 years, we've been looking at these 4 parameters. Opioid use, so morphine milligram equivalent per case, pain scores, cost, and complications. And we create a score just like the NASDAQ index of quality. So 500 is the number, and you get the number for the entire group, and you get your number as your own surgeon and look at it. And I want to show you what difference has that made for our surgeons. So first, let's look at cost, because one of the 4 things in it is actually the cost of the surgery. So these are the 4 of the 5 surgeons in our group, and in each column you see one of the years. So in orange is 2018, in light blue is 2019, and in dark blue is 2020. So the first thing we did is we shared with every surgeon exactly the cost of everything they use in their procedures. So this is, for instance, gastric bypass, and you can see we found that there's significant degree of variability in the cost of gastric bypass among surgeons. It's not only outcomes, but it's also cost. But once we shared with the surgeons what they're using, the surgeons on themselves started making changes that improved the cost of the surgery over time. And then this is sleeve gastrectomy. Again, 3 years, 2018 in orange, 2019 in light blue, and 2020 in dark blue. And again, we identified that in sleeve gastrectomy and in gastric bypass, staple line reinforcement, namely seam guard, is the highest cost that contributes to the bottom line in these surgeries. And over time, our surgeons made changes. One of our surgeons did not use staple line reinforcement. 3 out of the 4 made changes in what they use and were able to actually decrease the cost without worsening the quality of care of patients. And then the other area we looked at is opioid use. So in the US, there's a national program to reduce opioid use, and over time, we've been able to keep the pain scores the same and reduce opioid use. And the idea is, by sharing data with surgeons, it's more likely that surgeons will make changes that actually help the patients. So what are the takeaway messages? The takeaway messages is, because we have a lot of diverse patient populations and procedures within IFSO, there has to be lessons learned that we can share with each other, but you cannot have a cookie cutter method because our patients are different, the procedures we do are different, and the resources present at every place are different. The second is that if you want to look at quality outcomes, you need to be able to risk adjust the data. Because if you don't risk adjust the data, the surgeons who do the highest, most complex cases will look like their outcomes are worse. Not because their outcomes are worse, but because the data is not risk adjusted. And I think once you do that, it's very easy to actually look at your own cases and try to improve your quality. And then at the end, when we look at surgery, because our surgery is high volume and have potential for complications, the cost of the surgeries we do is significant. So for us in our practice, we've looked at sleeve gastrectomy, and after this exercise, we found that despite all the literature about reflux, this, that, and the other thing, but sleeve gastrectomy is a procedure that could be done with very limited variability amongst surgeons who are extremely experienced as compared to gastric bypass. So again, quality improvement is a journey. It's not a destination. It takes time. And again, I want to thank the Obesity Society Surgery of India for the invitation, Dr. Kaitan, Dr. Shivram, Dr. Raj, and Dr. Wadawan. Thank you very much.
I'd like to request the dignitaries on the dais to felicitate Dr. Abdul Rahman Nimeri. Ladies and gentlemen, the Aussie International Orator, Dr. Abdul Rahman Nimeri. In a typical Karnataka style, the Mysore Petha. We now have another proud moment and important agenda. May I call upon Dr. Pradeep Chaube sir and Dr. Raman Goel, the chief editor and the editor of the Journal of Bariatric Surgery, onto the dais to release the first ever copy of the Journal of Bariatric Surgery. While we are releasing the first copy of the Journal of Bariatric Surgery, may I also request all the EC members and other people who have contributed to stand up wherever they are so that the delegates can recognize, appreciate, and applaud them. The first copy of the Journal of Bariatric Surgery. May I request Pradeep Chaube sir or Dr. Manish Khaitan to address.
Has been a very historic moment, and we never thought it will become a reality, unless until Dr. Raman proposed and Dr. Pradeep disposed. And it was a very hard work done by Dr. Raman. The whole credit goes to few people who has behind it. And Aussie, I think, has stepped a step ahead by publishing this journal. Its first copy is out, and I congratulate the whole team, especially Dr. Raman, Dr. Kamal, and Dr. Pradeep Chaube. I'll invite Dr. Pradeep Chaube. Kindly come and say a few words, sir.
Thank you very much, Dr. Manish. It's really a very historical moment for Obesity Surgery Society of India, for all of us who are involved into the bariatric surgery program. It's almost 2 decades of the hard work, and now it's getting the light of the day in terms of the hardcore evidence-based publication. And I am really thankful to our president, Dr. Manish, who coined this idea, and Dr. Raman, Dr. Kamal Mahawar, and the whole editorial team to put in their efforts tirelessly into this project. And within no time, much before we expected it to see the light, we are here with the actual physical copy published. And I'm sure this is showcasing the Indian surgeons, not only to the world, but also we will be very happy and we will be delighted that all our institutions, our doctors, surgeons in the Indian subcontinent over a period of time surely will be publishing and feeling proud of their publication in this journal. With this, I'm sure OSSI will be a step ahead in terms of the academics in the world. And there are 2 other journals we know in the world, and I'm sure this journal coming from Asia Pacific region will produce synergy with these 2 journals and increase the importance of evidence-based medicine and surgery. So once again, congratulations to Dr. Manish Khaitan and the team, OSSI team, to Dr. Raman Goel, Dr. Kamal Mahawar, and to you all for contributing for this journal. And all the best. And this is just the first step. I'm sure a long journey ahead of us, which we will successfully complete, because the first step is the most important step. Thank you very much.
Thank you, Pradeep Chaube, sir. Thank you, Raman Goel, sir. It's indeed a proud moment. We would like to felicitate Dr. Pradeep Chaube, sir. I'll invite all the dignitaries to felicitate Dr. Pradeep Chaube, sir. I also invite our esteemed guests from BOMS to also be felicitated. Dr. Vinod Menon, President BOMS, Dr. Dimitri Pornaras, Dr. Chetan Parmar to join on the dais, and I request the dignitaries to honor all the 4 distinguished dignitaries. May I request Dr. Raman Goel also, sir, to join on the dais. It's customary in our culture to felicitate our esteemed guests as well as distinguished dignitaries. Ladies and gentlemen, Pradeep Chaube, sir, Dr. Vinod Menon, Dr. Raman Goel, Dr. Dimitri, and Dr. Chetan Parmar.
So thank you, Mr. President, Dr. Manish Khaitan, and the entire executive committee of OSSI and the entire general body of OSSI, all the members who gave this responsibility to our team. And on behalf of the team, and many of them are here, the Indian associate editors, editorial board members, advisors. We also have international members. Dr. Nemeri is our member of the editorial team. Dr. Chetan Parmar is here. So for all the members, the journal copy will be available tomorrow. The physical copy will be available tomorrow at the registration counter right from morning. So please collect your copies. Those who are not here tomorrow, the copies will be mailed to them. So please take your copies, physical copy from here. And this journal is an open access journal. And there is no charge for the OSSI members as it has been decided by the OSSI Executive Committee. So thank you so much once again for this responsibility and trust in us. And over to Dr. Manish Khaitan, please.
We have another important agenda to be covered today. We also have the release of the e-souvenir of OSSICON 2022. We were waiting for Dr. G. Siddesh, President ASI, but I think he's getting delayed. So we would request Dr. Manish Khaitan, President OSSI, to also release the e-souvenir of OSSICON 2022. I request Dr. Kalevani to stand up there. She has been the force behind the e-souvenir from the organizing team.
Dr. Kalevani, please. She is the editor.
Oh, great job. We have been through it. A very great job. So Shivram is in Bangalore and he has used the technology completely. And this e-souvenir I have gone through is just beautiful. So I take this honor to release this e-souvenir in OSSICON 2022 to all members.
we will be sending the e-souvenir to each one's mobile as well, all the registered delegates, and their emails as well. May I now request Dr. Sumit Talwar, Organizing Secretary of OSSICON 2022, to propose the vote of thanks.
Thank you, Manish. It's a pleasure and an honor for me to have been the organizing secretary for such an auspicious, such a big event in the bariatric surgery calendar of India. So first of all, I would like to thank our Honorable Health Minister, Dr. Mansukh Mandaviya, to have spared time and to have graced us with his kind words. I would also like to thank the President ASI, Dr. G. Siddesh, although he is not physically present. I would like to thank our patron, Dr. M.G. Bhatt, for being the guiding light and the beacon. I would like to thank our international orators, Dr. Nimeri, the BOMS delegation. I would like to thank Dr. Manish Khaitan, President OSSI, Dr. Randeep, Secretary OSSI, Dr. Praveen Raj, incoming President OSSI. I would like to thank all the past presidents, trustees of OSSI. I would like to thank Dr. Chaube for releasing the Journal of Bariatric Surgery, which indeed is a proud moment for OSSI. And I would like to thank Dr. Raman Goel for working hard in making this a reality. I would like to thank all the delegates and all the faculty who have actually made this conference a success. Without them, it wouldn't have been possible. Last but not the least, I would like to thank the industry sponsors, our Platinum, Gold, and other sponsors who have worked with us shoulder to shoulder and helped us and supported us in making this a success. The foot soldiers of our conference, Alpcod, our event managers, Planotech, our production managers, and Anand Peter, our audiovisual guy, who has made this all seamless. In the end, I would like to thank the institutions that all of us are working in to have supported us and to have allowed us to continue with this journey of bariatric surgery, which has been a difficult one for a lot of us. In the end, I would like to thank Hotel Sheraton and its management. I think Namita wants me to thank someone. I am not getting it. Sorry? Alpcod I have already thanked. Thank you very much. And please enjoy the conference. Please enjoy the evening. Thank you very much.
Thank you, Dr. Sumit Talwar, for the vote of thanks. Before we ask everybody to rise for the national anthem, Dr. Abhay Agarwal would like to invite you to Mumbai for 2023.
Good evening, everybody. It gives me immense joy and pleasure to announce the OSSICON 23 in Mumbai. And the dates selected are 2nd and 3rd of March. 4th will be the operative workshop. If you can remember, the first OSSICON was held in Mumbai in 2003, and 20 years later we have it again. In between, we had it once with Dr. Raman Goel. I would like to extend my personal invitation to all of you to join in large numbers. My team and Mumbai Bariatric Club is working hard to give you a memorable event, and we are making sure that you will have an academic and a social feast which you've never experienced before. The weather in Mumbai will be just pleasant in March, and we have an early bird offer which you can avail. We're giving some fantastic discounts, so please use them. And I personally welcome all of you and see you in Mumbai next year. Thank you.
Thank you. May I request everyone to stand up for the national anthem.
Happy Gandhi.